Hello friends, welcome to our channel PKR Vibes Career and Growth. First of all, thank you for your time to spending here to learn something new today. Today we will discuss about B11 denial in our medical billing. This denial description is not covered by this payer. Okay guys, now we are discussing about the basic or common reasons to get the B11 denial from the insurance companies. So generally we know the concept that on behalf of doctors, the billing team are submitting medical claims to the insurance companies, and insurance companies will acknowledge or they accepted the claims, and they will start the adjudication on a claims. So adjudication is nothing but the claim started processing the claim, and after process the claim they finalized into the payment or denial. But here we are discussing about B11 denial, that is nothing but insurance is denied the claim stating that not covered by this payer. So I given four common reasons to get the B11 denial. First one we will discuss about incorrect insurance information. So by sentence we can understand that there is a insurance information is a incorrect. So there is a mismatching. So generally what happen, while submitting the medical claims to the doctors, the billing team are submitting incorrect information to the insurance companies. So insurance companies will give the denial stating that not covered by this payer. So that is one of the reason, and I given non-covered services as a other service reason. I mean other reason. So generally, due to the policy limitations and exclusions of the policy holder, some services are covered and some services are not covered to the insurance companies. So generally, while taking the policy, the patient given, I mean insurance company will give the patient, I mean consent to the patient that this kind of services are not covered. For example, even the patient is consulted the doctor given the treatment to the patient, and the doctor submitted the medical claims to the insurance companies, but the insurance company is denied that due to the policy limitations and exclusions these services are not covered under the patient plan. So nothing but medically they are not necessary, I mean medically they are not valid points to process the claim and to give the benefits to the doctors. So that is what insurance is. Understand that these are the non-covered as per our payer guidelines, and nothing but as per patient policy our payer is not giving the benefits to the doctor. So there is a no scope of that kind of services. At the time we will get the bill 11 denial from the insurance companies. And third point I given as a coordination of a benefits. Nothing but if the member, I mean if the patient has more than two insurance companies, or if the patient has multiple insurance policies, the claim may need to be transferred to the correct payer for coordination of a benefits. But insurance, but claim is billed to insurance, but we don't know whether it is a primary or secondary. But if you are billing claim to insurance, I mean secondary, you are submitting secondary insurance to the as a primary to the insurance. So the patient as primary and secondary or tertiary insurances generally. For example, if you submitted secondary insurance as a primary to the insurance companies, insurance company is denied that coordination of a benefits issues. They are telling that not covered by this payer, or they will give the remark code that misrouted claim. So in that way, also we will get the B11 denial from the insurance companies. And incorrect billing codes. Fourth point. So here incorrect billing codes are nothing but due to the diagnosis or CPT code, whatever billed on a medical claim form by the coding team. If you are billing different diagnosis code, generally whatever the treatment is given by the doctor to the patient, then what happen, because of that diagnosis code, whatever given by the patient to the doctor is different, but whatever the billing on a medical claim form is different. So the diagnosis and the treatment whatever given by the doctor to the patient is not consistent, in the sense what is, it is incorrect. So while you are submitting the diagnosis code which is not appropriate to the whatever the treatment is given by the doctor to the patient is not valid, if you are billing the claim to the insurance companies, then insurance companies will deny, stating that this is not covered, not deemed medically necessary also. So based on diagnosis and the treatment, these services are not covered. In that way also we will get the B11 denial from the insurance companies. Okay guys, now we will discuss about pre-call analysis for B11 denial. So if you are getting, if your claim is submitted to insurance company processed and they denied the claim stating B11, and in your respective PMS you found that claim, EOB is received from the insurance companies, that EOB is telling as a B11. So at the time, directly instead of calling to the insurance companies, you should have to do a pre-call analysis. Nothing but before calling insurance companies, you should have to do a basic analysis on your claim. So first point I given as a verify payer information. See guys, this is a eligibility denial. Max 90% this is a eligibility denial. Without calling to insurance, you will close this denial if you are a good at analysis. So first point I given as a verify payer information. Nothing but generally we will get mismatch of payer. Due to the mismatch of payer information, we will get B11 denial. So that is what you should have to verify correct payer information. So how you will verify the correct payer information? Basically, you should have to run the eligibility for denied payer. For example, you submitted claim to X insurance, you should have to run the eligibility for X insurance, so that you will get who is the primary insurance, who is other additional coverage details under the eligibility page, so that you will analyze, you will understand that who is primary, who is secondary to the patient or member or subscriber. So your first job for B11 scenario for pre-call analysis is you should have to run the eligibility, double check the payer's name, address and the contact information to avoid any transfer issues, and also stay updated on a payer changes. Generally what happen, uh, COB information will be updated with the insurance companies, so that that information will be also updated on a portals or updated with the insurance companies. So if you run the eligibility also, you will get the status on a COB information also. So you should be stay updated on a payer changes. So first point is you should have to verify payer information. Second point is complete and thorough documentation. See, why I given this point is you should have to explore the documentation, complete documents. Why? Because while exploring the patient information, you will be got to know that who is the valid payer to this patient. Who is the active valid primary payer to this patient. So you should have to verify the plans and what kind of patient have a different plans types also there. So in that way you should have to verify your documents of patient documents or related documents in your PMS systems. And third point is you should have to check previous procedure and billing history. Generally, whenever the claim is denied for not covered by this payer, check previous payer history. So how the claims are billed, what kind of payer we billed previously, so from where the claims are, how the claims are closed previously, who are acting as a primary insurance previously. Now you build this insurance, but this insurance is telling that not covered by this payer, but previously what kind of insurances patient has, and also how the claims are closed. So for example, if the claim is denied due to the diagnosis related issues, check previous diagnosis and procedure build history. So how the claims are built, what kind of diagnosis code is built to this kind of CPT code previously. So for example, previously we build the diagnosis and CPT and we got the payments previously, then you have to understand and analyze that we got a payments for the same kind of diagnosis and CPT codes previously. Why this time is insurance is denied? In that way you should have to do a good analysis on a claim. Then you should have to call the insurance and you should have to probe that previously we got the payments on a similar kind of diagnosis and procedure codes. Now you are denied as a non-covered or not covered by this payer. Why? So in that way you should have to do a thorough checking on that pre-call analysis. Okay guys, now we are discussing about AR callers on-call steps for B11 denial. So generally, for example, I'm telling your claim is submitted to insurance companies and you checked your internal clearinghouse for claim status of electronically submitted claims. I mean for electronically submitted claims, and you checked but you don't find any information on your electronic submitted claims in your clearing houses, and in your respective PMS practice management system also you doesn't find any claim status. I mean you didn't receive any EOB from the insurance companies. And also if you have a access for portal for that particular insurance, you check the claim status in your respective payer portal, and also you didn't find any information, but you got to know that claim is already acknowledged and received by the payer and they started adjudication. I think they processed the claim, I think, but you don't know any, I mean, otherwise you simply that claim was submitted to the insurance company, you don't know any claim status on a claim. Then as a AR caller, your the first question is, may I know the claim status please? So, but how you are talking, for example, your name is Thomas. Hi, this is Thomas calling from provider's office checking on a claim status. Because you don't know any claim status, you checked as a pre-call analysis in your system, but it doesn't find any claim status. Then your job is to, may I know the claim status please? At the time, insurance will provide the claim status that yes, we received your claim and we processed your claim. Your claim is denied, stating that not covered by this payer. Or sometimes what happen, in your respective PMS you received denied EOB from the insurance company stating that the claim is denied for B11 denial. At the time your question is, hi, this is calling from provider's office checking on a denied clarification please, because you already have a denied EOB available in your respective practice management systems. So at the time, if rep provided any other covered payer details, for example, rep telling that the claim is denied for not covered by this payer, but we have a information that what is the correct payer. If if insurance representative is provided any other covered payer details, get more details. So what is the other payer name, what is the other member ID, payer member ID, and what are the other payer claim submission details, then you should have to work accordingly. Work accordingly means if insurance is provided partial details about other covered payer details, for example, claim is I mean insurance is telling that other insurance, for example, I'm telling Cigna is a other covered entity, but we don't have a Cigna's member ID and complete payment details with us, I mean complete claim submission details with us. At the time, as a AR caller, your job is to take the call reference number and close the claim for this denied insurance, and you should have to call to that Cigna insurance with the patient first name and last name and the date of birth. Then you have to call to Cigna. You should have to get the complete payment, I mean, sorry, claim submission details for the Cigna, and you should have to verify policy is active with the Cigna or not as a primary. If the Cigna is a primary, then you should have to add that insurance in your respective PMS system, and you should have to bill that claim to Cigna as a primary. In that way, you should have to close the claims. But here, for example, I'm telling if the rep is unable to provide any other details, but on your analysis you found that this denied insurance, for example X is an insurance which is denied the claim stating B11, you found that if you verified the patient details, I mean patient documents, you confirm that X insurance is only the primary insurance. At the time, how you know? As per patient documentation, as per patient uh, I mean patient details, I mean patient related documents, you confirm that this insurance only the primary insurance. You have a documents with you. At the time, you should have to probe the same information with insurance representative that we already have a documents with us, patient documents, and we finalize that this insurance is only the primary insurance. And however, we already we bill the claims to your insurance as a primary previously, and those claims are already processed by your insurance, and we got the payments also. Could you please reprocess the claim? If the denied payer only responsible to cover the benefits as per patient documents or as per previous payments histories, at the time as a AR caller, you should have to request to reprocess the claim over the phone call itself. At the time, ref will verify from their end, and if they got to know that that is correct and valid as per patient documents, and if they are realized that whatever uh, denied insurance is only the responsible for the payments to the doctors as a primary, at the time ref will reprocess the claim. They will agree and they will reprocess the claim. If the claim was reprocessed over the phone call, at the time as a AR caller, you should have to take TAT of reprocessing period. So if the claim is reprocessed, there is a reprocessing period time. I mean period means there is a time, turnaround time. So generally it will take 30 to 45 business days or 15 to 30 business days as per payer guidelines. At the time, so as a AR caller, you should have to take the TAT and you should have to take the call reference number. You should have to close the call. See guys, I'm telling this is very rare to reprocess the claims on a B11 denial. Generally, the first thing is that insurance may be covered by some other, other payer details they will provide. At the time, we should have to bill to other provider details. So, and if, for example, as per patient documents, you confirm that X insurance, I mean denied insurance is only the valid payer, but insurance representative is refused to reprocess the claim. At the time, as a AR caller, you should have to take the appeal details, because as per patient documents we clearly have that this insurance only the primary, I mean accurate, I mean valid payer, but insurance is not reprocess the claims, but insurance is denied telling that this is not covered by this payer. But as per patient documents, we confirm that this is only the insurance should have to process the claims and give the payments as a primary to the doctor. So at the time, you should have to take what is the appeal timely filing limit, and how you will process the appeals. For example, if rep told that we will not accept the appeals through the fax, then what is the mailing address to send the appeals? So what is the appeals mailing address? For example, if insurance representative is telling that we are not accepting the paper appeals, at the time you should have to ask what is the fax number to do an appeal, with whose attention we should have to send this fax as an appeal. So at the time you should have to work accordingly. So based on in question, you should have to uh, ask the necessary and appropriate questions on a phone calls. So I give a note point guys, mostly the B11 denial is a non-callable scenario, eligibility based scenario, because if you run the eligibility you might be get other covered payer details on eligibility page. Okay, now we will discuss about the end actions on a claims of a B11 denial. So generally, I given action 1, bill the claim to correct payer or valid payer. If you run the eligibility, or if you call the insurance, you got a correct information of a valid payer. At the time, your job is you should have to add that valid payer in your respective PMS system, and you should have to bill that claim to that valid payer as a primary to get the benefits from the insurance companies to the doctors. That is your first action. Or for example, insurance is agreed over the phone call. They are telling that they denied the claim incorrectly. They are only the valid payer, but they processed the claim incorrectly previously. Now on call, the rep agreed to send the claim back for reprocess. At that time, you should have to reprocess the claim over the phone call itself. I'm telling this is a very rare scenario. And third action is on call, you are probing as per the patient documents that the whatever you denied the claim as a B11 is a incorrect. Could you please reprocess the claim? But insurance representative refused to reprocess the claims as per their guidelines, as whatever the reason. But as a AR caller, your job is to get the fax details, I mean appeal details, and you should have to submit an appeal with the necessary documents. I mean whatever the patient documents you have, and what are the service documents which is related, or you have to prove in that we want payments from the insurance companies. In that way, whatever the documents you have to appeal the claim. So at the time your action will goes to appeal on this B11 denial. This is also very rare. So action 4 is I given bill patient for valid cover payer details. So for example, you are calling to insurance and insurance is telling that we don't have any other payer information with us, but we will not cover this payer, and I mean we will not cover this as a valid payer. At the time, they will not reprocess also, and also you don't have any documents which is related to patient as a uh, who is primary, who is secondary, or other payer details. You don't have any other information, and insurance also doesn't have any other information of a valid payer with them. Then obviously it is our job to contact to patient, I mean bill to patient for a valid covered payer details. See guys, on B11 denial, if you are a submitting, I mean sorry, if you are a contacting patient or if you are a billing patient, you should have to clearly have to given the statement we are billing patient for a valid cover payer details. So the action 1 and action 4 is majorly we will see on this B11 denials. So these are the actions I provided on a B11 denial. Guys, if you felt content is useful, could you please like our video so that it will reach us many more needy people who are looking this kind of content. It will reach us them. And also, if you are watching my video first time, if you not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth, and hit the bell icon so that you will get every our videos as a notifications to your mobile. And thank you so much again. Thank you so much for your time. Have a good health. Bye for now.